What abnormality comes to mind when looking at this view with an enlarged right ventricle? This is a short axis view of that patient. RV is clearly enlarged. Aside from RV enlargement, there appears to be a defect in the inner atrial septum, but this is nothing more than a dropout or defect. Echo dropout often occurs when ultrasound waves are parallel to the septum, leading to image loss, most commonly at the fossa ovalis, where the septum is very thin. It usually mimics an ASD, but contrast study and multiple imaging planes help differentiate it. This contrast study shows no passage of contrast bubbles across the septum and confirms that mid-septal defect as a dropout or defect. However, a negative contrast study doesn't necessarily confirm an intact septum. This TE view suggests a normal inner atrial septum, and another TE view confirms its apparent integrity, but precise evaluation is not yet complete. All parts of the septum, especially the areas near the SVC and IVC, must be carefully assessed, along with the pulmonary vein connections. This view reveals a large sinus venosus ASD. Sinus venosus ASD is far less common than ostium secundum ASD. Here, a 3D image provides a clearer visualization of the defect. In conclusion, sinus venosus ASD compared to ostium secundum ASD is much more challenging in terms of diagnosis and management. Unlike ostium secundum ASD, sinus venosus defects are not within the fossa ovalis, and transthoracic echo usually misses them. A negative contrast study cannot rule out these defects, and even transesophageal echo may not provide a clear view if not carefully evaluated in multiple planes. Almost all cases involve partial anomalous pulmonary venous connection, which adds to the left-to-right shunting and further complicates management. Surgery is more complex, and repair requires careful reconstruction of the septum while ensuring normal pulmonary venous drainage. The challenge is avoiding SVC obstruction or creating new flow disturbances, and sinus node dysfunction may be a complication.